Good morning, my dear students. Today we will learn on how to collect or how to administer a mini mental status examination to a patient. Okay, so mini mental status examination is administered in order to assess the patient cognitive function or in order to evaluate the patient cognitive function. Okay, so if you want to know whether the patient's cognitive function is intact or whether there is any impairment in the patient cognitive function or not, you can administer this mini mental status examination to a patient. Alright, so before going to the procedure, we will learn on the history of mini mental status examination. Okay, so it was first developed by Folston MF in the year of 1975. Okay, so it is shortly known as MMSE. So mini mental status examination is abbreviated as MMSE, and it is most widely used instrument in order to evaluate or assess cognitive impairments in patients. Okay, so it is a 30-point screening tool, and remember that MMSE is just to evaluate the patient cognitive impairments, but it is not meant for diagnosing a dementia. Okay, so next is the advantages of MMSE. So the advantage of MMSE is that to do mini mental status examination, you need not require any equipment or you need not carry any equipment to the patient bedside, and it requires very little critical thinking skills in order to interpret the patient answer or in order to interpret the patient response, and it is very quick to administer because it takes very less time to finish this procedure. Okay, within a short span of time you can finish administering this MMSE to the patient. That is, it can take only 10 minutes. So next is the components of MMSE or the categories of MMSE. Okay, so first is orientation. So in orientation we check for temporal and geographical orientation. Second is the language. In language we see for the reading comprehension, writing, repetition and naming. Third is registration. So in registration, first the patient need to register on what you told, and the second is they need to recall on what is being told, and the next is mental reversal, and the last is the construction praxis. It's nothing but copying a figure where it includes visual as well as spatial tasks. So the first one is the orientation. So in orientation, again we have seen that it is divided into two, that is temporal orientation and geographical orientation. So when you want to assess the patient temporal orientation, when you want to assess whether the patient temporal orientation is intact or not, you can administer this set of questions to the patient. Okay, so you can ask the patient like, what year is this, what season is this, what month, what day of the week, and what date is today. So these 5 questions can be administered to the patient in order to assess their temporal orientation, and remember that each correct answer carries 1 point. Okay, so out of 5, if the patient give correct answer, you can give 5 points. So each question carries 1 marks, remember that. Okay, so second one is the geographical orientation. So when you want to assess the patient geographical orientation, when you want to know whether the patient is oriented to the place where they are, you can pose this question to the patient. So the questions are like, where are we now, and what state we are in, which country is this, what city is this, and what floor are we in this hospital. So these 5 set of questions can be administered to the patient in order to assess their geographical orientation. So again here, remember that each correct answer carries 1 point. Okay, so the next is attention and calculation. So attention and calculation, what type of question you need to administer to the patient is, here you need to tell the patient to spell the word whirl. Okay, the word whirl, tell the patient to spell it in backward, and if the patient can able to spell it correctly in backward, each correct letter you can give 1 points. Okay, like example here I've given the word whirl. When we spell it in the backward, it will come DLROW, right? So the patient here spells correctly, each letter is correct, right? So you give it 5 points. So the next is again DLORE. So here the patient made a mistake, right? So only 3 letters are correct, so you give it 3 points. So like that. Okay, so alternatively, serial subtraction also can be done in calculation, so what type of question we have to do is, or what type of activity we can do here is, you need to tell the patient to do serial subtraction from 100. Okay, so 100 minus 7 is how much? You can ask the patient like that. So 100 minus 7 is 93, right? So again, 93 minus 7 is how much? And 86 minus 7 is how much? Like that. Till 5 subtraction, you have to go on from 100. Okay, so after 5 subtraction, you need to stop that and you need to give points for each correct answer. Okay, so in the serial subtraction, you need to count from 100 minus 7 and each correct answer you give it 5 points. And in the attention, you tell the patient to spell any word. Okay, so here the word I have taken as whirl. So if the patient can able to spell correctly at the backward, you can give points according to how many letters the patient has spelled correctly. Alright, so this is about attention and calculation. So the next one is registration. So in registration, what we have to do is tell the name 3 objects and tell the patient to say that. Okay, so you name any 3 objects. So here objects I have taken as apple, pen, and television. So these 3 objects I have taken. Okay, so tell the patient, give these 3 words to the patient and tell the patient to register it in their memory. Alright, so take 1 second to say each word. So each word you have to make a pause for 1 second. Like for example, apple, you say it apple and then you need to give a pause for 1 second. Then you need to go to the next object, that is pen, like that. Okay, so then ask the individual to repeat the names of all 3 objects. Okay, so after giving the name of the 3 objects, tell the patient to repeat the 3 objects and give 1 point for each correct answer. If the patient can able to tell correctly apple, pen and television, you give it 1 points for each. If the patient cannot able to recall that, then you need not give a mark. Okay, each correct answer you have to give 1 point and repeat the object names until all 3 are learned. Until and unless the patient has learned the object, you should not skip or you should not go on to the next component. Alright, so the next one is recall. So in recall, what we have to do is whatever object names that you have given, you have taught to the patient. Okay, you tell the patient to recall those 3 objects. So here we have given 3 objects, that is apple, pen and television, right? So if the patient can able to recall those 3 objects, apple, pen and television correctly, you can give 1 points for each correct answer. Alright, so the next one is the language. So in language, the first one is what you have to do is you need point by pointing to a pencil and a pen. You ask the patient to tell the name. Okay, you point a pencil and tell the patient to name the object. If the patient can tell that it's a pencil, you give it one point. And then you point it to a watch, and if the patient can able to say that it's a watch, then again you give it a 1 point. So the next is ask the patient to repeat the following, that is no ifs and or buts. So if the patient can able to say this no ifs and or buts, then you give it 1 correct answer. So for this only 1 trial is required. Okay, so the next one is give a person a piece of blank white paper. Okay, so give the patient a piece of blank white paper and ask them to follow the 3-stage command. Okay, so you give a blank paper to the patient and tell them to follow the command. So what the command says is, take a paper in your right hand. The patient should take the paper in the right hand, fold it in half and then put it in the floor. So if the patient can do this command correctly, you give 1 point for each part that is correctly followed. Okay, for each part you give it 1 point. So the next is you write close your eyes. Okay, so in a white paper and in a large letter you write it close your eyes and tell the patient, tell him or her to read the message and do what it says. So here it says close your eyes, so the patient need to close their eyes, right? So if the patient can able to read that close your eyes, and if the patient can do exactly what it says, that is close their eyes, then you give it 1 point. Okay, so if the patient doesn't close their eyes, you need not give any scoring to the patient. Okay, and then the next is ask the individual to write the sentence of their choice on a blank piece of paper. So you give a piece of blank paper and tell the patient to write a sentence. And remember that the sentence should contain a subject as well as a verb, and it should make sense. Okay, whatever sentence that the patient is framing, it should make a sense. You forget about the spelling, forget about the pronunciation and grammatical mistake, but then remember it should make sense. Okay, so if the patient can able to make a sentence, then you give it 1 point for that. So the next is show the person a drawing of two pentagons. Okay, so you draw a two pentagons like this, and then it should intersect each other. Okay, two pentagons should intersect each other, and they should form a quadrangle. All right, so each side should be about 1.5 centimeter, and ask them to copy the design exactly as it is. So exactly how you have drawn, it should intersect and it should form a quadrangle exactly like that. If the patient can able to draw that, you give it 1 point. All right, and all 10 angles need to be present, and the two shapes must intersect to score 1 point. Okay, remember that the two pentagons should intersect each other and all 10 angles should present. You ignore those tremors and rotation, it should not be that perfect. You ignore those things, but then you see that the pentagon should intersect and it should has a 10 angles. All right, so how do we interpret this MMSE score? So the widely accepted cutoff point is 24/30. Okay, for MMSE. So scoring here we do it. How do we do the scoring is, for if the patient score 27 to 30, it is normal. If the patient score 21 to 26, it is mild cognitively impaired. If the patient score 11 to 20, then the patient is moderately cognitively impaired. And if the scoring is 10 to 0, then it is severely cognitively impaired. All right, now this is the format that I have given. So according to this format, you when you go and administer this to the patient, you take this format, you memorize this format, and according to this format you need to administer. Okay, so in orientation you make draw like this, and according to this you administer and you write it down according to this. Okay, right, in orientation you take all these questions, then according to the patient response you give the scoring. Okay, and in attention and calculation, in orientation the total point is 10 points. Okay, so we administer 10 questions, right? So each question, I told you that each question carries 1 mark, right? So in orientation it has 10 points. Then in attention and calculation we give it 5 points. Then registration, the total point is 3 points. Recall, again here is 3 points. And in language, the first, when the patient can able to name pencil and wristwatch, you give it 2 points. If the patient can able to say no ifs and or buts, then you give it 1 point. If the patient can able to follow the 3 commands, then you give it 3 points. Then if the patient can able to close their eyes and follow exactly what it says, you give it 1 point. If the patient can able to write a sentence, you give it 1 point. If the patient can able to draw these pentagons correctly, then you give it 1 point. So the total scoring is 30. All right, so I hope every one of you have understood. If you have any doubt, you ask me, and then for your more clear understanding, I have put up this video. So you watch this video and you go relate with that with those points that we have discussed. Okay, so you watch this video and correlate with those. So thank you so much for attentively listening. Thank you everyone.